All right, good afternoon, folks. It's Jeremy with the Hospital PT, back with another video. Just left work, put my hat on, and I'm not sure about you guys or gals, but there's something about putting the hat on at the end of the day that kind of caps things off real nice. All right, so this video for today, we're going to talk about assist levels and terminology and what those things mean from a physical therapy standpoint or occupational therapy standpoint in the hospital. So if you or your loved one is leaving the hospital soon, you might hear a therapist say something along the lines of, "Oh, your mom is standby assist for walking," or "Oh, your mom is or dad is they require minimal assistance to transfer to the chair," or something like that. And specifically, if you hear standby assistance, you may think, "Oh, well, they're basically independent. They could really do this by themselves." But that's not entirely true. And as the video goes on, I'll explain what that means and why that may not necessarily mean that your loved one is independent. So remember, guys, I'm a hospital physical therapist. I've been doing this for anywhere between, I guess, 12 going on 13 years. And our job in the hospital is to assess how safely someone can move once they go home, or how safely they can move in the hospital and once they go home. So in rehab, we use very specific language, to describe how much help someone needs. And that language isn't always very clear to patients and their families. And so they make sense to us clinicians, but they can sometimes be confusing or misleading to patients and their families. And so let's take a few minutes and let's break them down. So real quick overview, we're going to cover 5 general levels of assistance. And those are: number 1, independent; number 2, supervision; number 3, standby assistance; number 4, contact guard assistance; and number 5, physical assistance and its various levels. So that's total assist, maximum assistance, moderate assistance, or minimal assistance. And we'll cover those in a little bit of detail as the video goes on. So the terms are used across physical therapy and rehab medicine in various settings to standardize communication across clinical environments and between clinicians. So I can call a physical therapist at another hospital or another facility and say, "This patient is being transferred to you guys, and they require minimal assistance for all transfers." And in general, that therapist is going to understand how much assistance that means that they will have to provide for that patient once they get there. So let's go through the different levels. Okay, so I mentioned level 1 being independent, and that's exactly what it sounds like. This person can get out of bed, stand up, walk, sit down without anyone present. And that's a very high level of mobility, and that's what, typically most folks that live at home and operate on a normal daily basis, they are independent for most of those activities that I labeled. However, they may use a walker or a cane, or maybe grab bars, depending on the situation. And this is a different type of independent, and it's called modified independent if they require the use of an assistive device, but they don't require supervision or physical help or standby assistance. So level two, that's supervision. Okay, supervision means that someone should be in the room or nearby, but they usually do not have to physically touch or assist the patient. And so think of supervision, you could think of it sort of like safety monitoring, or I'm there to help remind them to grab their cane or grab their walker or grab the bar, Make sure you stand up all the way, those types of things. And so common reasons why someone might require supervision, if they have mild balance deficits, or if they have a slow movement speed, or if they struggle with just a little bit of disorientation, or mild confusion. The caregiver's role here would mostly be just to watch and cue for safety monitoring, okay? So like I said earlier, an example of that may mean, okay, mom, make sure you grab your walker before you get up to go to the bathroom. Now, that brings us to level 3. And this is standby assistance. And it's an often misunderstood, and a lot of the confusion when it comes to assist levels comes around this term, standby assistance. So standby assistance means that the caregiver should always be within arm's reach of the patient or their loved one during any movement at all. Or it may mean that they need to be within arm's reach for a specific movement. So in other words, the patient may be able to sit up on the side of the bed with supervision, but when they go to transfer to a bedside commode or to a recliner, they may need standby assistance. And those are two different things. For instance, supervision to get out of the bed may mean, Dad, make sure you grab the bed rails, roll to your side, and push yourself up with your arm. When he's cued for that, he can do it and sequence those movements together to effectively sit up on the side of the bed. Versus once he goes to stand and transfer over to a wheelchair or some other chair, the caregiver needs to be within arm's reach if he requires standby assistance for that transfer. And so that means that in reality, here's what that looks like. This means that anytime a patient is going to stand from a chair, get out of bed, or walk to the bathroom, or do anything else that requires them to move themselves from one location to the next, you cannot leave the room during those activities. And in fact, not only can you not leave the room, you need to be within arm's reach of the patient. And so why is this so important? And that's because research in geriatrics shows that small balance deficits dramatically increases fall risk when standby assistance or supervision is absent. Okay, and I use those two terms, those two levels of assistance on purpose, because both of them require the caregiver to be present. And so a small balance deficit can dramatically increase the fall risk when supervision or standby assistance isn't present. And falls are extremely common after hospitalization, especially among older adults. And so also data from the CDC, okay, it shows that millions of adults over age 65 experience falls each year. And with each fall, for my patients in my practice at the hospital, I call every fall is like the wild west. You may pioneer out to the wild west and nothing may happen, or you may take a trip out to the wild west and things get really hairy really fast. And so each fall is akin to that. Some falls may be inconsequential, but it only takes one fall in the wrong location or to hit the wrong thing or to break the wrong thing, and now things unravel or can unravel very quickly. So that gets us through level 3 of in talking about standby assistance. And now that brings us to level 4, and this is contact guard assistance. So things get a little more clear here. Contact guard assist means the caregiver is lightly touching the patient while they move, okay? This may involve a hand on a shoulder or under an arm or on a gait belt or grabbing the pants or something along those lines. And the key here is that the patient still performs most of the work. The caregiver isn't providing necessarily any external assistance to aid in the movement. The patient can complete the movement, but a hand needs to be on them at all times for safety purposes. So This level, it's commonly used when someone has mild instability when they're walking or when they're turning. So, for instance, someone may be standby assistance to walk in a straight line with a walker. They may be contact guard assistance to make a turn around an obstacle with that walker. All right, that covers level 4 contact guard assistance. Level 5. This is where we get into the topics of, or the delineations of total assistance, maximum assistance, moderate assistance, or minimum assistance. All right, let's keep this real simple. Total assistance means that the caregiver or someone else has to do 75% of the work or more. Okay? Maximum assistance. That means that the caregiver has to provide 50% to 75% of the physical effort to help that patient complete that movement. Moderate assistance is between 25% and 50% external assistance is provided by the caregiver to complete the movement. Minimal assistance is 25% or less, down to about, obviously not 0%, because you wouldn't be helping them at all. That'd be contact guard or some of the other ones we've talked about. So that means they help. If someone is maximum assistance to stand up, that means that I would have had to do about 75%, 60% of the total physical effort to get that patient on their feet. That's a lot. That is a lot of assistance. When you have a patient that requires that much assistance, that means that burden on that caregiver is going to be very, very high. All right, so at this level, the caregiver burden, like I'm alluded to, is much, much higher, okay, because it requires more physical assistance. And additional services like rehab or skilled nursing or home health physical therapy or other community resources like that become a much bigger part of the equation for that patient and their family at that particular point. So here's the big takeaway. When clinicians say standby assistance, families often hear, well, they're almost independent. And remember, like we covered, that's not true. In reality, it means that someone should always be near, very near, within arm's reach during any movement. Okay, and I know that seems like a subtle difference, but it really matters. Studies in health research and health services research show that misunderstanding post-hospital care instructions is a major contributor to falls and to readmissions. Okay, so that's what I'm trying to do with this video, is help these terms make more sense to you, or at least inform you so that you can ask questions and get clear on what the hospital staff or the hospital rehab staff means when they use these terms. Okay, so before you leave the hospital and you're getting ready to leave, the hospital's trying to discharge you in the next day or so, and you start hearing these types of things like, hey, your loved one requires minimal assistance to get up to the bedside commode or something like that. I want to leave you with 3 questions to ask. Okay, number 1, can they get to the bathroom alone? The staff should be able to answer that, or there should be documentation indicating, is that possible for that patient or not? Number 2, do I need to be in arm's reach of that patient at any given time for any given transfer or movement? That helps you to know how present you need to be with your loved one. Number 3, which movement is the biggest fall risk for my loved one? And that helps you understand, if they say, listen, they can't stand up without needing moderate assistance from the bed, then you know that you're going to, as a caregiver, you will be required to be readily present anytime that patient needs to get out of the bed for anything. Use the restroom, go to the kitchen, change clothes, whatever it happens to be. So if someone in your family has ever been discharged from the hospital and you were left with questions that you didn't feel like you had good answers to, comment in the comment section below, say assist, okay, in all caps. I read every comment and it helps me to create videos that answer more specific questions than you guys have. I'm covering some general topics that I come across every day that patients and their families struggle with to get clear answers on. And so in the next video, we're gonna cover 3 warning signs, 3 red flags to be on the lookout for after hospital discharge that often leads to readmission. Okay, so stay tuned for that video. It'll be coming soon, and we'll see you on the next one, guys. I'm wishing if you are a loved one or in the hospital, I'm wishing you a safe hospital stay and a safe discharge. Until next time, take care. This is Jeremy with the Hospital PT.